How do you make a baby in a lab? In patients undergoing IVF, FSH is administered at levels that are higher than naturally occurring to cause a controlled overstimulation of the ovaries so that they ultimately produce multiple eggs. The eggs are then retrieved just before ovulation would occur, while the woman is under anesthesia through an aspirating needle that is guided by ultrasound. Most sperm samples are produced by masturbation. In the laboratory, the identified eggs are stripped of surrounding cells and prepared for fertilization in a petri dish. Fertilization can occur by one of two techniques. In the first, the eggs are incubated with thousands of sperm, and fertilization occurs naturally over a few hours. The second technique maximizes certainty of fertilization by using a needle to place a single sperm inside the egg. This is particularly useful when there is a problem with the quality of the sperm. After fertilization, embryos can be further screened for genetic suitability, frozen for later attempted pregnancies, or delivered into the woman's uterus via catheter. Common convention is to transfer the embryo 3 days after fertilization, when the embryo has 8 cells, or on day 5, when the embryo is called a blastocyst and has hundreds of cells. To increase the odds of success, which are as high as 40% for a woman younger than 35, doctors sometimes transfer multiple embryos at once, which is why IVF results in twins and triplets more often than natural pregnancies. However, most clinics seek to minimize the chances of multiple pregnancies, as they are riskier for mothers and babies. Millions of babies, like Louise Brown, have been born from IVF and have had normal, healthy lives. The long-term health consequences of ovarian stimulation with IVF medicines are less clear, though so far, IVF seems safe for women. Because of better genetic testing, delayed childbearing, increased accessibility, and diminishing costs, it's not inconceivable that artificial baby making via IVF and related techniques could outpace natural reproduction in years to come.
The first in vitro fertilization facility in Mindanao formally opened at the Women's Center of Brokenshire Hospital in October 28, 2015, with hopes to reach out to couples who are going through challenges in fertility. Its primary purpose is to provide a laboratory center that caters to procedures on reproductive endocrinology and infertility cases, and be recognized as one of the most promising fertility laboratories in Southeast Asia. Its mission is to deliver globally competitive service with compassion, respect, and utmost accountability and quality care to clients, and to provide a venue for continuing medical education through training and research. Counseling and information drives remain one of the priorities of the facility. Since our inauguration last October 2015, we have had 83 cases of oocyte retrievals and 64 cases of both fresh and frozen embryo transfers. With an overall pregnancy rate of 40%, we are at par with global statistics. High-order gestation, like twinning, is controlled and monitored in the practice of assisted reproductive technology by limiting the transfer of good-quality embryos in utero. 3 of the 5 frozen sperm samples retrieved through testicular microsurgery resulted to pregnancy. The first successful delivery at preterm gestation are twins baby boy Sky and baby girl Rin, born February 23, 2017 at Brokenshire Hospital. All delivered babies are healthy and free of gross abnormality. Lately, we are glad to welcome diagnosed cancer patients who opt to undergo oocyte freezing prior to chemotherapy.
In Vitro Fertilization Davao Incorporated is located at Brokenshire Women's Center Building, Brokenshire Hospital, Madapo Hills, Davao City. Or you may contact us at 298-0311. You may also visit our website at www.ivfdavao.com and like us on Facebook at www.facebook.com/ivfdavao. In Vitro Fertilization Davao Incorporated, turning you into parents.